Quick disclaimer, this video goes through what a typical smoking cessation call looks like at the clinic with many behavioral changes sprinkled in. We hope you can get a better glimpse into our calls through this video. Enjoy!
Hi Alan, my name is Subin and I'm calling from Dr. Curnew's office. I run a smoking cessation program here at the clinic, and I heard that you were interested in implementing some strategies to cut down on the amount of cigarettes that you're smoking, and even possibly quit altogether. Is it okay if I ask you a few questions?
Hi, Subin. Yeah, it's nice to hear from you. I'm definitely interested in quitting smoking, but I'm not really sure how to start. And I'm worried that I just won't be able to keep up with the demands of it. I think that's my biggest concern.
No worries. Why don't you tell me a little bit about your smoking history? We can start off with when you started smoking, how much have you smoked in the past, and how much are you smoking currently, and have you tried quitting in the past?
Oh boy, well, where do I start? I think I started smoking roughly at the age of 19, and it's been 45 years. So you can kind of see how long I've been smoking. And throughout this 45 years, I think I've about basically averaged a pack a day on average. And that's how much I'm currently smoking. In the past, I've tried quitting multiple times using everything, using gum, sprays, but it just didn't work. And the most success I've had only lasted for a few months before I relapsed. I've currently been under a lot of stress recently, and smoking has been kind of my go-to way with dealing with that stress. And it's just become a huge part of my daily routine, having smoked for over 45 years. And I'm not sure if I really am able to kind of break through this really old habit.
No worries at all. That's why we're here to help. So let's discuss some strategies to overcome your smoking habits. The first one that I recommend is simply picking up a new hobby, which can help to keep your mind off smoking.
A new hobby, whether that is gardening, cooking, arts, puzzles, or crocheting like I'm doing here, can help distract you from your initial cravings and break up your regular routine of smoking. Pick up something that you know you'll enjoy and that's fairly easy for you to do anywhere you go. If you can plan diversions ahead of time to limit idle moments in your day, you will experience less urges to smoke.
Wow, that actually sounds great. I've never really thought of smoking as a habit or even a hobby, and it seems like replacing it seems to be very feasible, and I have a lot of interests that can greatly take up the time that I usually spend smoking. Another question I had regarding my smoking is that a big part of why I smoke is also due to the oral sensation I get from puffing on my cigarette. And I'm also trying to watch my weight, and I don't want to eat too much food. And I find that smoking actually helps keep my mouth busy.
You could try eating a healthy snack or brushing your teeth.
Chewing on sugarless gum or some crunchy snacks like crisp grapes, pretzels, and nuts can help distract your mouth from wanting a cigarette. It is important to choose healthy snacks in an effort to steer clear of any unnecessary weight gain.
When it comes to quitting smoking, oral fixation can be a struggle for many. A tip to overcome these cravings is to brush your teeth instead. Occupying your mouth with something other than a cigarette will help distract you from your cravings and help pass the time in a healthier way. Using other oral substitutes such as eating a mint or using a mouthwash are also great alternatives to smoking. Smoking has also been shown to increase your risk of gum disease and reduce the effectiveness of possible treatments in the future. In addition to helping you quit smoking, brushing your teeth can help freshen your breath, whiten your teeth, and remove yellow stains caused by smoking.
Yeah, absolutely. I do find myself also trying to limit the amount that I snack during the night. So I think definitely that will also help with my oral hygiene, which is a great idea. But I think I have another question. I also find myself smoking a lot in these cases, for example, when I'm on the phone. And do you have any recommendations for that?
Yeah, of course. So you could try replacing the cigarette in your hand with another object like a pencil. Habits and routines are difficult to change. However, these are important challenges that you must overcome to avoid triggers and successfully quit smoking. For example, if you often smoke while talking on the phone, hold a pencil in your hand instead and take notes or draw to keep both of your hands busy and your mind away from smoking.
Yeah, I think that's great. Instead of just puffing on a cigarette while I'm on the phone with you currently, I think I can just play with a fountain pen that I have on my desk. I think just having that physical thing can help with just, the sensation of holding it. Well, thank you so much. I don't want to take up too much of your time, I know, but I think I have one last thing. as I mentioned before, a big part of why I smoke is also due to the stress, because my job requires me to always be on my toes, and the work seems to be never ending. I work 9 to 5, but it seems like the work hours always seem to extend past it and into my family time. And just smoking has been a way for me to kind of deal with it for the past several years, and it seems I can't really escape smoking until I find another job or until I retire.
Well, it's certainly good that you're able to identify the source of your cravings, and while your job may be the cause, there are many strategies that you can implement to help manage that stress. So you could try calling a friend or maybe your family members, a close coworker. You can try engaging in exercise, even if it's just walking, and practice mindfulness like deep breathing and yoga.
The journey to quit smoking can be a difficult one. Thus, it's important to have a strong support system that can be there throughout the momentous moments, but also the more difficult ones. For example, when you feel the urge to smoke or have that craving to do so, a good outlet to relieve that feeling is to talk with a friend, family members, or a telephone quit line. You can reach out by way of a phone call, email, or text messages, depending on the method you find the easiest and the most convenient. These conversations will likely distract you from your impending desire to smoke and also reinforce the reasons you initially decided to quit. Spending time with friends and family at places where you're unable to smoke, like museums or movie theaters, even restaurants, is a great way to overcome craving, as it once again keeps your mind from thinking about smoking. It is important to note that at least at the start of your journey where cravings might be more apparent, to surround yourself with people that are not currently smoking, and overall limiting your interaction with smokers. This will help to reduce cravings and urges to smoke in general.
Physical activity is a great distraction to suppress your cravings. Even if it's not intense running, try going out for a walk or climbing up and down the stairs in your home to make your cravings go away. You can invite your friends and family members to join you and turn it into a healthy family event. You may be smoking as a way to cope with stress. Resist the temptation to smoke a cigarette and try practicing mindfulness techniques such as deep breathing, music relaxation, yoga, or visualization.
Nice. Well, yeah. Hey, Subin, thanks so much. I think just after this call, I'm really motivated. And I think I'd like to set a quit date for 2 weeks from now. So maybe every week until then, is it possible for you to just give me a call? I'm someone that really benefits from accountability and just having someone to constantly remind me. I think it's really good. And I'm just looking forward to improving myself.
Yeah, absolutely. I'll book you for in about 2 weeks' time for Tuesday.
Perfect. Sounds good. See you then.
All right, bye.
All right. Bye.